Hello and Assalamualaikum. My name is Mohamad Ikmal Tajuddin bin Abdul Hadi. I am from SBH3. Today I am going to present one of the most infamous disease among the cattle industry, which is Bovine Respiratory Syncytial virus or BRSV. The virus also known as Bovine Orthopneumovirus, which responsible for an acute respiratory syndrome in cattle. Without further ado, we proceed to the introduction of the topic. BRSV is an enveloped, non-segmented, negative-stranded RNA virus belonging to the pneumovirus genus within the subfamily Pneumovirinae and family Paramyxoviridae. Next, we are going to look at the taxonomy of the virus. The genus Orthopneumovirus is included in the family Pneumoviridae. There are three types of orthopneumovirus, which is bovine, human, and murine. The one that is responsible for the BRSV problem in cattle is bovine orthopneumovirus. Etiologically, the virus is known for their characteristic cytophatic effect, which is the formation of syncytial cell. BRSV infection associated with respiratory disease occur predominantly in young beef and dairy cattle. BRSV can be considered as a primary BRD pathogen and is also a component of the bovine respiratory disease complex. Passively derived immunity does not appear to prevent BRSV infection, but reduce the severity of the disease. Initial exposure to the virus are associated with severe respiratory disease. Subsequent exposure result in mild to subclinical disease. In outbreaks, morbidity tends to be high and the case fatality rate can be 0 to 20%. Next, we are going to look at clinical signs of BRSV. One of the obvious signs is dyspnea, possibly with open mouth breathing, may become pronounced in later stage of the disease. As you can look in the picture here, the cattle have trouble in breathing. Other than that are depression, decreased feed intake, fever up to 40 to 42 degrees Celsius, and for adult cattle, you may see a drop in milk yield. Next is increased respiratory rate, nasal and lacrimal discharge, subcutaneous emphysema, and edema. As you can look at the picture, the cattle with edema usually facing an expansion of the interstitial fluid to produce either subcutaneous swelling or accumulation of fluid in the lungs, thoracic cavity, or abdomen. A diagnosis of BRSV requires laboratory confirmation. BRSV is a difficult virus to detect, although chances of isolation may improve when sampling animals in the incubation or acute phases of infection. Although virus isolation is difficult, PCR is a useful and rapid method commonly used to detect the antigen. Other procedures that have proved useful in detection of BRSV antigen are fluorescent antibody and immunoperoxidase staining. If the animal has succumbed to the disease, a postmortem can be performed to aid diagnosis. Diseased lung tissue from that animal or centrifuge cell from lung lavage can be used for this. Next is treatment and control. There is no specific treatment for the viral interstitial pneumonia. However, treatment focuses on the antimicrobial therapy that are able to control secondary bacterial pneumonia. Supportive therapy and correction of dehydration may be necessary. Other than that, treatment with antibiotics is often used to treat secondary infection and lessen clinical signs and help the body focus on eliminating the virus. Finally, there are anecdotal reports of treatment with antihistamine and corticosteroid being used. For the prevention measure, the owner of the farm needs to separate the cattle according to their age. Mixing of cattle with various age may increase the potential spread of BRSV. And the most important thing is by maintaining a good hygiene of the farm. Next is geographical distribution. BRSV is thought to be worldwide in distribution, many countries having a high number of seropositive cattle. While the number of seropositive animals is high, the reported incidence rate of respiratory disease is much lower because many infections are clinically not apparent. BRSV has been isolated from numerous countries including the USA, Austria, Japan, Australia, North Africa, and many countries in Europe. Lastly, we are going to look at the public health risk. As far as the research goes, there is no cases of BRSV occurs to human. However, there is similar virus which is HRSV that's specifically infecting human, especially infant. That's all for me. Thank you for your attention.